Hi, I'm Dr. Sally Foote from Veterinary Clinic, and I'm going to give you a tour of my veterinary practice. I've had people ask me when I speak and write how to help rearrange their existing veterinary clinic to be less stressful, more following the fear-free practices, the low-stress handling practices. So this is my waiting room, and we remodeled or built this waiting room about 25 years ago, and it's pretty typical to a lot of veterinary practices. So what we've done, this is the reception desk area, as you can see, but we keep our treats in jars right out here, and yes, I have my little piranha cats here, so that not only for my receptionist, as soon as somebody walks in the door, she can reach and get one of the treats, but the clients, we encourage them to get a treat and give, say, to their dog right here, and that rewards the dog around this front area, and plus keeps the dog more calm for entering in. We want them to associate a good thing as soon as they come in this exam room, seeing the receptionist, seeing the desk, and that. Then my techs also can grab a few treats as we come around here to the scale. So as you come around here, this is where we have our scale for weighing our dogs and our pets, and they will automatically get a treat here. Now we can pull the scale away from the wall as well for dogs who get a little nervous about being confined, by the bookcases. But then some dogs kind of like, I think, the bookcases to keep them corralled. One of the best things in this waiting room, without realizing it, was when we put this small coffee table in the middle of this area where the seating area is. A big problem we often have is one client sitting here with their dog and one client sitting over here with their dog. The dogs are facing each other and they start to bark, or they start to pull, or they start to lunge. Or a dog comes in the front door there to see another dog sitting here and immediately pulls the client in there, and we have some reactivity. This table, this little table, sitting right in between, really reduces both the barking, the staring, or pulling. The dogs see that as an obstacle, and they don't try to, pull through. Or even the dog coming through that front door sees that table here, and they will tend to stop more in that immediate area, just helping to give more control into the waiting room. We also have here, this is a cat tree. And for our office cats, they can easily go up onto this perch, onto the cat tree, top of the bookcases, on that shelf. So not only for our cats living here, but say you have a dog who wants to chase cats, and the first thing they do is they come in that door barking and pulling. Our cats can get out of the way. When that cat gets up here, then the dog doesn't pull as much because there's nothing to go after. Secondly, when we have a client come in with a cat in a carrier, we can have them set the carrier up here off the floor. We don't want the carriers on the floor so much because the cat feels vulnerable. Now let's walk down here toward my examination room area, and I'll show you some things that we have done in the exam room. So this is our hallway here, and I do not have a typical front-back treatment area. I do a lot here in the exam room. This used to be a physician's office. So we come around here, and in the examination room, the first thing you may see is that we have a lift table, but it's kept down. Keep the lift table down. Then it does not look like a table, which often triggers a lot of dogs. The second thing I have is this little shelf above my sink holds our smorgasbord of treats. Remember, one treat does not fit all. So we have a variety of nice, chewy, flavorful treats. We have like the wellness treats here and the epi treats for the hypoallergenic diets. We preload our syringes with peanut butter or liver paste so we can squirt those into muzzles, or this makes a good target for dogs. I have my pretzel sticks here for doing mouth examinations on dogs especially, so that way they won't react against my hands, or even like a tongue depressor for a mouth exam for a cat. Other things that we also have here is over in the corner here, we have put a cat carrier. So if a cat, let's say they let them out of the carrier before we get in the exam room, this is providing that kind of hiding cubby area, and we keep it disassembled because for some cats that get upset and you need a base of the carrier to have them in, and your own carrier might be the nuts are rusted shut and you can't get it taken apart, then we can get them out of their carrier and put them in just the base of this one, putting it on the exam table to do the carrier exam techniques, for examination. We do keep our muzzles here, and we always use positive muzzling. You can see that in my other YouTube videos where we use rewards in there. This laptop, the printer, this is so we can check the client out in the examination room. And that really helps to reduce a lot of congestion and agitation out in the waiting room area, thereby also decreasing stress. And my staff is trained to escort the client out and also prevent dog-to-dog interaction, either telling the other staff, let's get the other dog behind that reception counter, and then they can go straight out with the client. We do have the Adaptil diffusers, and on my little table here where I'll write my notes and things, I always have the Feel Away, always have Adaptil. Use it early, use it often. 5 sprays on you, 5 sprays on the bandana you hand to the client for that dog to start wearing right now, or at least 5 sprays on the blanket or towel you put on the exam table or cover over the carrier with. But these are things that we did. It didn't take a lot of money. It just took a little bit of thought and thinking ahead to organization and always having things available, and just building up on that. So thank you very much. And anybody with questions, email them in to me. I look forward to it. Bye.